Douglas, my name is Joy, Short Pacific Cataract and Laser in Bellevue. Dr. Brzezinski is your surgeon today. You're looking at a picture of your eye magnified out about 30 times, being held open with an eye spring. Dr. Brzezinski starts by opening up the protective membrane called conjunctiva. He'll then cauterize blood vessels. This is going to minimize your blood loss to less than a drop. These blood vessels will reroute and regrow themselves in about a week to 10 days. He's also going to take a diamond scalpel now and make an 1/8 of an inch incision into the front of the capsule. This is called a scleral tunnel. It's the main incision he uses to remove the cataract. Your cataract sits inside a capsule just behind the pupil. That's why the pupil's nice and dilated. Brzezinski will now add a thick fluid. This thick fluid is going to cushion the front of that capsule as he gets ready to make an opening in the front of it. But first he'll make 2 pinhole incisions, one on each side. All 3 of your incisions are made at an angle, so they're self-sealing, and usually you have no need for any stitches. Now that the incisions have been made, he'll come in from the left and make the opening. He takes a small amount of membrane and rotates it around in a circular motion. And this creates the window that he needs to remove the cataract. You can see the membrane coming around in a circular motion there, right in the center of the eye. Now that that window's been created, he will add a balanced salt solution. This will float that cataract off at the back of the capsule wall. The thick fluid he added earlier, you'll see coming out, which is perfectly okay. He's going to rotate that cataract around in a circular motion. You can see it being rotated right there. The instrument that he'll be using next is called a phacoemulsifier. It's an ultrasonic instrument. This instrument's going to be vibrating 40 to 50,000 times per second. It's going to break apart that cataract, liquefy it, and then suction it out. As it breaks it up and suctions it out, he will add back a balanced salt solution so you never lose any pressure in the eye. He has taken an instrument in from the right. He's going to use that instrument to help break up the cataract and also to help move it towards the emulsifier. Your cataract is a gray gelatin material. You see right there in the center of the eye that's being extracted. So the nucleus of the cataract is now removed. What remains is called cortex, and that's the soft tissue left behind by the cataract. So Dr. Brzezinski will change instruments. This one's no longer ultrasonic and there's no vibration. He will suction that cortex out, once again adding back the balanced salt solution. As you can see, there's some air bubbles floating around in there. Sometimes those get left behind. It's perfectly okay. Your body will just absorb them. The nice orange color you're seeing is the light reflecting back from the retina now that the capsules become clear. So now Dr. Brzezinski is going to polish the back of the capsule, make sure it's nice and smooth and ready before he inserts your new lens. He's now going to add a thick fluid. This thick fluid, once again, cushions that capsule as he inserts the new lens. Your new lens is going to be a foldable lens made of high-tech plastic. It'll be all rolled up, coming in via a lens injector. It will have a blue arm on the bottom and one at the top, and those are going to be called haptics. Those haptics are going to spring to the insides of that capsule wall and hold the lens in place. This is a prescription lens prescribed especially for you. So the lens fits back inside the capsule that the cataract came out of. The haptics spring to the insides of the wall and hold the lens in place. Now that the lens is in, Dr. Brzezinski will change instruments. He will suction out the thick fluid and replace it once again with a balanced salt solution. He'll also then check pressure in the eye, making sure the incisions have all sealed themselves. You'll get your first set of medicated drops. They'll remove the eye spring. The sterile drape will come over the front of the eye and your surgery will be complete. Congratulations and enjoy your new vision.